Hello, and welcome to the Asthma and Allergy Foundation of America's latest education program titled Biologics 101. Today's program is developed independently by AAFA and made possible through the generous support of AstraZeneca, Sanofi, and Regeneron. We are so glad you are here. My name is Stacy, and I am the Public Health Manager here at AAFA. And also, you will meet my colleague and our speaker here in just a few moments. But first, before we dive in, I would love to tell you a little bit more about AAFA and who we are. The Asthma and Allergy Foundation aims to be a trusted ally of the asthma and allergy communities. We are dedicated to saving lives and reducing the burden of these diseases through advocacy, support, education, and research. Without you guys, our community out there, we would not be here. So thank you for everything that you do everywhere for those living with asthma and allergies. Again, my name is Stacy, and I'm really happy to be your host today for the program. Your speaker, who you will meet in just a moment, is Dr. Jessica Peck. And finally, we have a whole team of AAFA staff assisting on the back end, making sure everything runs smoothly today, answering your questions, supporting your polls out there. But first, let's review a few house rules. Everyone's video and audio are on mute, but we would love to hear from you during this program through our chat box. So if you see a little chat box on your screen and you have a question during the discussion, if Dr. Peck is saying something that sparks a question, please feel free to type that question in and throw it on over to our chat box. I do want you to know that we may be unable to answer any questions about your case specifically, but for those questions you have, I do encourage you to bring those to your own personal healthcare provider and/or doctor. Throughout today's program, we will also be asking you some polling questions. We encourage you to respond to these questions. And in addition, please take a moment at the end of the program to complete the survey questions. Your feedback is so important and so valuable in providing insight into this experience and helping us plan for future educational programming. So with that, let's talk a little bit about our agenda and what we will be discussing today. Today we will talk about biologics. What is a biologic and how does it work? And we will then talk more in depth about biologics for asthma and related conditions. And we'll also talk about if a biologic is right for you and how do you talk to your healthcare provider about a biologic. Then we're going to jump into some common steps to starting a biologic, as in what role does your primary care physician, your NP, specialist, pharmacist, and even your insurance company play in the coordination of care for the biologic you are on. We're going to talk about what to expect from a specialty pharmacy and patient advocates and navigators. And finally, we're going to share practical tips to your biologic journey. So here are our disclosures. And this is our speaker, Dr. Jessica Peck. She is an advanced practice nurse practitioner and highly accomplished in her field. She has served in elected leadership positions in a variety of professional organizations, including the American Association of Nurse Practitioners, the National Association of Pediatric Nurse Practitioners, and Texas Nurse Practitioners, while maintaining active membership in the American Public Health Association, the National League for Nursing, Phi Kappa Phi Honor Society. Her distinguished background includes being a tenured professor at Texas A&M Corpus Christi College of Nursing, associate professor of nursing at UT Health Science Center School of Nursing, and Will Dean Bivens Singleton Professor of Pediatric Nursing at the University of Texas Medical Branch. She has a vast clinical experience, which includes League CD Pediatrics, Pediatric Consultants, and Clear Lake Regional Medical Center and UT Physicians Bay Area for Pediatrics. Wow, Dr. Peck, that's so much. As a pediatric nurse practitioner and devoted wife and mother of 4, Dr. Peck has a special interest in education and equipping families to promote positive physical, emotional, mental, social, and spiritual health. So I am so excited for you guys to meet her today and for her to deliver this presentation. And I would just like to get to know our audience a little bit more. We love to see who's out there. And if you feel comfortable, share a little bit about, do you or someone you know or care for receive a biologic for asthma, food allergies, eczema, nasal polyps, CSU, or EOE? So those polls are open, so you guys, please feel free to answer those polls. I know having a chronic condition like asthma can come with its share of challenges, but we know there's power in community, and there's a lot of that community here at AAFA. So we thank you for answering these, and let's take a moment to close those polls and see what our answer is. And it looks about 50-50. So we have a really great audience here, a really broad audience in caring or receiving those biologic medicines and really just wanting to know more. Okay, audience, we have one more question for you. So let's test all of our knowledge. Let's launch those polls right now. And our question is, audience, if you feel comfortable, tell us what you think a biologic is. And while we're looking at these answers, maybe you think it's a medicine used to stop an allergic reaction, or maybe a biologic is a medicine that is made from living things such as animals, plants, or bacteria, and it's used for the prevention and treatment of disease, or maybe it's a supplement used to treat those ragweed allergies. Let's see what the audience thinks and what I think here, and I'm going to close those polls in just a second to see what our most common answer is. And let's close it. And it looks like our most common answer is the medicine that is made from living things such as animals, plants, or bacteria used for the prevention and treatment of a disease. So thank you so much, audience. It's so great to know who you are out there and know a little bit of where we need to start for this program and presentation. And now I'm going to hand it over to Dr. Peck, and she's going to tell us what is a biologic medication.
I am going to do that. And thank you, Stacy, so much for that kind introduction. It's so nice to be with you all today. I know as human beings, our most valuable commodity is our time. So the fact that you are here learning with us, having your lunch with us, or whatever time of day it may be where you are watching from, I know this is something that's important to you. And you may have heard about all of my credentials, but I think it's really important to also share right up front that two of my children had asthma. One of them was very severe, and one had very severe eczema growing up. Now, they're old enough now that biologics were not an option for them. And honestly, neither was the internet. So trying to find information in what my children refer to as back then and previously the last century where there was no internet, it was really hard to find information. But it's so great to be able to connect with all of you and to be able to give you some information that you can trust and that will hopefully be helpful to you in making those decisions. For me, as a nurse practitioner, I really care about body, mind, and spirit. And I know these chronic conditions, they impact us as holistic human beings. And so biologics are really an exciting option that may not be right for everybody, but they may be right for you. And that's what we're going to help give you some information so that you can try to figure that out as we go on. Now, we just had a slide where we were asking what is a biologic, and so here is our answer. Biologic drugs, or biologics, as they're often called, just simply a biologic or biologics, they're a kind of medicine that is made by living things. That could be animals, that could be plants or bacteria. And many of these biologics are antibodies, and we're having increased public awareness of what antibodies are, what they do, what the possibilities are. Those are proteins designed to block specific molecules or tiny particles in the human body. So basically, biologics work by disrupting cells, by blocking specific modules that trigger inflammation, which is such a driver in so many of these conditions that we're talking about today. There are all kinds of biologics. There are many different kinds, and many have been around actually for a long time. And they are used for a wide range of diseases and conditions. It's a very broad group of medications, and they're different different from each other. For example, a biologic that treats Alzheimer's disease is very different from a biologic that may treat asthma. So today we're really going to focus on biologics for asthma and those related inflammatory conditions like eczema, polyps, food allergy, EOE, CSU. We'll talk about all of those things, and many of those may be very familiar, some of those may be new. So let's start off with, how are biologic treatments administered? This is one of the most common questions we get, something that really requires a lot of understanding because it's different. Because biologics are given, I'm just going to say it right up front, they're given through an injection, a shot, or IV through a vein as an infusion. Now, a lot of people say, whoa, 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 wait just a second, but hang with me here. Let's walk through it together. It's important, I'm going to say this over and over again, to discuss with your primary healthcare provider how you would receive your biologic, whether it would be a shot or an infusion, or how often it would be. And after proper training and education, your healthcare provider and team will make a decision together with you when you might be ready to even start to do this at home. And we'll walk through this. Some biologic medicines come as a manual push, a pre-filled syringe, and some come as a pre-filled pen or an auto injector that can deliver your exact prescribed medicated dose. Now, depending on the medicine prescribed to you by your healthcare provider, those shots or infusions, they may be repeated anywhere between 1 to 8 weeks as an average range. Each biologic medicine is different, so it's important to discuss that with your personal healthcare provider, your doctor, your nurse practitioner, your PA, your allergist, whoever it is that's managing your condition, how often you should administer your own injection and follow specifically that prescribing instruction and the drug manufacturer instructions that come with your biologic medicine. Now, there are some that have to be given as an infusion under the direct care and supervision of a healthcare provider. Basically, we have to do it for you in a clinic or some sort of clinical setting. Infusions are mostly given at an infusion center or clinic, but sometimes, again, you can receive it at home, either a healthcare provider coming to your home or learning to do it yourself. It depends on the medication and your situation, and that's a question to write down to ask your healthcare provider. Now, when you get an infusion, a lot of times this is in a clinic setting, although sometimes, like I said, it can be set up that your healthcare provider comes to your home to do it. And it can take 30 minutes to an hour to give it. And sometimes it's very common to be monitored for a little while after the infusion just to make sure there's no immediate reactions, that everything went smoothly, you can feel good about getting up and going home, and you're free to go about your day. Now, biologic infusions can be given for several illnesses and conditions, and those infusions are basically liquid medications that are given to you through an intravenous or IV needle in one of the veins, usually in your arm. They're not all given at once. They're administered slowly over a certain period of time. Now, when you're getting an infusion, that does require that you would need to travel to an infusion center or clinic. For some patients, that's a lot easier than others. For me, I live in Houston. We have infusion centers everywhere. In more rural areas, that may be a barrier that you need to talk about. Schedule your infusion appointment, making sure that you have enough time to get there, you're not stressed, you get the infusion, you have the waiting period, and then to go home. And it takes a little longer than it would if you're giving yourself a shot at home, and especially if you're used to doing that and you have it down pat. But the other side of that is you only need to get them done every 1 or 2 months, depending on what medication dosage and the interval that you're prescribed. Now, whenever you get to an infusion center, you check in just like you always do. You get a medical professional, tells you where to go, where to wait. Usually these are nurses. There are nurses who are infusion specialists. That's all they do all day, every day. And they direct you to the infusion area. You get settled in a comfy chair. They look at your arm, see which vein is the best for an IV. And again, a lot of times in an infusion center, they do this all the time. So you've got really skilled IV starters there, and they'll place that little IV needle connected to a thin tube into your vein. And once that IV is started, then they can connect the infusion, and that medication moves through that little teeny tiny thin tube into your vein. Now, infusion centers, they usually have very comfortable chairs to sit in while your infusion is administered. You can wear loose and comfortable clothing. It's preferable if you have something with easy access to your arm so that you can get that IV without too much inconvenience. Now, biologic infusion times vary, but you'll likely be sitting for at least 30 minutes, so you want to plan for that, especially if someone's bringing you. Let them know how long that would be. You can bring something with you, like a book or a magazine. If your electronics are charged, you can bring headphones. You can stream things on your device and listen to music if you want to. For me, I have to get my kids to help me remember how to do that, but you can do that while you're waiting to pass the time. Now, after your first infusion, again, that healthcare provider, sometimes it's the nurse giving the infusion, or other healthcare providers who are there in the clinic, they're going to watch you for a little bit afterwards. It's usually between 15 and 60 minutes. Depends on the policy of the place. It depends on the medication you're giving. Depends on your own personal medical history. But they're going to look for things like an allergic reaction, like you would look for any medication. And that can present like if your lips start to feel swollen, or you start to feel a little short of breath or have a rash. Those are some common signs of an allergic reaction. And you should also be provided information with who to call as you're leaving. They'll give you a number to say, if there's any problems, any questions, here's where you can reach us. Now, some of you your ears may have perked up when I said biologic injections can be done at home. And this is becoming more and more common, not just for biologics, but for other kinds of medications to make them more accessible. Now, injections means you'll need to inject the medicine like a shot into what we call the subcutaneous tissue. That's that kind of fatty, squishy tissue just below your skin. And most commonly, this is done either in the stomach or the upper arm or the thigh, and those injection sites usually rotate so that you're not using one all the time. And biologics that you can give to yourself, they come as a pre-filled pen or an auto injector. So many of you may be familiar with a device like this, a spring-loaded syringe. It only requires you to hold it to your skin and press a button, or it's a manual pre-filled syringe with a little plunger that you put into your skin and push the medicine in. But again, if you were going to have this at home, you would get more training, and we're going to talk more about the training, the support, and the storage for biologics a little bit later. So just hold tight and we'll get there. It's important for you to know that biologics work differently for everyone. If you are prescribed a biologic, it's medicine, not an instant miracle. It can take several weeks before you start to notice a change in your symptoms. Just because you don't see it working immediately, that does not mean that it is not working. It just takes time for the medication to build up in your system, and you want to keep giving that biologic exactly as prescribed, along with any other medicine that you've been prescribed, until your personal healthcare provider says it is safe to stop. Now, if you see multiple healthcare providers for multiple conditions, it's important to always have a complete list of all the medications that you're taking so that they can watch those and look for any interactions and fully advise you on that. So you want to make sure that anytime you have a change in your medication regime, that you're talking to all of those providers about that and making sure it's safe to stop or change something. Well, now that we know the basics of a biologic, how it works, what it is, let's find out more about specifically how it works for asthma and those related conditions that have most have some sort of inflammatory component underneath. So let's shift gears for a minute and talk about inflammation. Conditions like asthma and allergic conditions, they are driven by the same inflammation. So the good news is that means biologics approved by the FDA for one of these conditions can sometimes be studied and approved for other conditions as well. So biologics are going to treat that condition by disrupting the specific cells or blocking those specific molecules that are triggering the inflammation. And trigger exposure causes the molecules in your immune system to work together to create swelling in your airways. And many of us know what that feels like. It's not pleasant. Biologics attach to those molecules and they say, nope, nope, not going to happen. And they prevent them from causing inflammation and the symptoms that are associated with inflammation. Now, when it comes specifically to asthma, biologics are often prescribed in people with uncontrolled asthma, that it just is very disruptive to your life, and your personal healthcare provider, whether that's in primary care or a specialist that you're seeing, a doctor, a nurse practitioner, a PA, a specialist, they will help you decide if asthma biologics would be helpful for you. They're going to do this by looking at your symptoms, the type of medicine you are already taking, what have you tried already, and they'll probably do some blood tests to look at some results that will help them guide the best decision for you. So you will discuss together this information and have some shared decision making using their expertise in treatment and the disease and your expertise in knowing your life, your family member, what is going to be realistic, what treatment plan you're going to feel good about and confident about. Now, some of you may be wondering, well, how do I know if my asthma is uncontrolled? Well, here are some potential warning signs. And if you can say yes to any of these, I would strongly encourage you to talk to your healthcare provider about it and say, I want to know if my asthma is uncontrolled or if you feel like it's controlled. If you have asthma symptoms more than 2 times a week, if you wake up at night with asthma symptoms more than 2 times a month, or you need your reliever or rescue inhaler for symptoms more than 2 times a week, if you are taking oral corticosteroids, oral steroids, more than once a year, or you're just not able to do all of your usual activities because it will flare up your asthma, those are signs that your asthma may be uncontrolled. And you need to talk to your healthcare provider about crafting an individual plan for you to get that under control and to minimize your symptoms and maximize your long-term health impacts. Now, your healthcare provider might consider prescribing a biologic if you have moderate to severe asthma that remains uncontrolled, even though you're doing everything else you can. You're taking your routinely prescribed inhaled medicines or pills or whatever regimen your healthcare provider has you on for asthma. You're doing all of that and you're still having some of those symptoms we were talking about a minute ago. Biologics are an add-on therapy for asthma control. So that means you still take your asthma controller medicine, doesn't replace that. But over time, as your symptoms become more controlled, your healthcare provider might change how much of that you take. They might decrease your dose or change the medication that you're on. Again, biologics, it's important to know and have that realistic expectation up front that biologics are not quick relief medicines. They're not rescue medicines like you would use an inhaler. And they don't replace those relievers like an albuterol inhaler that you might use for immediate symptom relief. Now, this is a great slide that just shows you the range of biologics that are available for asthma. And many of you may be looking at that slide thinking, okay, I'm trying to figure out how to pronounce that and say that. You'll notice a lot of these medications end with the same letters. And so some of them are just called by the first part of their name. You may hear your provider refer to it by the generic name, like the official medication name, or the trade name, the name that it's marketed under. But the main point from this is to see what the range of medications that are available. You'll see that they are available for different ages. Some of them are approved for children. Some of them are just approved for adults. Some of them you can give in a clinic or at home. And you'll see those different dosing intervals. Some of them are every 2 to 4 weeks, but all of these are falling within the 1 to 8 weeks that we talked about before of how often that you have to get a dose. And several factors will be involved in deciding if a biologic is right for you specifically and your specific diagnosis of asthma. So that again is going to include things like, what kind of asthma do you have? How well would you be able to follow this shot schedule? Are you comfortable getting the injection yourself? All of those things would be things to talk about when you're deciding if a biologic is right for you. So many of the biologics for asthma also treat other things, and you can see down the left-hand column there all of the other things that biologics might be an option for. Those are things like eczema and rhinosinusitis and urticaria, the chronic spontaneous urticaria, or eosinophilic esophagitis, EOE. I think there are several who have experience with that. Again, that dosing and frequency may differ. The approvals differ by age. You can see there that may be something different. And there's other specific contraindications and precautions that you should talk through specifically. And the thing to know is that there's still so much research happening with these treatments, and there are other treatments on this list. This is not an exhaustive list. But researchers and drug companies and the FDA, they continue to look at other conditions that might be treated by biologics that are already on the market. So it's important to stay tuned to resources like AAFA right here, who are giving you updates on what is going on. Like with any drug or medicine, some people can experience side effects. So those injection site reactions are common, and that can be with any injection. Some people get a headache, some get a fever or muscle aches or a rash or joint pain or infections. And in rare cases, biologics can cause a serious allergic reaction called anaphylaxis. So certain treatments also have another warning called a black box warning. The black box warnings are safety warnings from the FDA. So it means you need to be aware of the drug's specific side effects and special instructions for safe use. So you want to speak again with that healthcare provider who's managing your condition before, during, and after starting a drug with a black box warning or any other new medicine or treatment. It's important to be fully informed of the potential side effects so that you can weigh the risk and benefit with them in making the decision, excuse me, that is best for you. So we like to use the phrase, if in doubt, call it in. So your healthcare provider is there for you. It is their job to answer your questions. And so if you have any doubts and you find yourself sitting at home thinking, well, should I call or should I not call? Yes, the answer is you should always call, because it's never a bad thing to be overcautious. And it's a reminder that if you have any questions about the way you're feeling after you take a new medicine, you want to call your healthcare provider right away and record and report any side effects you have so that they can make sure that your dosage is safe, that your prescribing situations are safe, and they can advise you on what you should do going forward from that. So I'm going to give it a break here and pass it over to Stacy for just a minute, and then I'll come back with some more information in just a minute.
Thank you so much, Dr. Peck. When in doubt, call it in. I love that phrase. I wrote that down, and I'm going to take that with me and along my journey wherever I go, to remind myself to call it in if I have any questions for my healthcare provider. So thank you for sharing with us with all of that information. And as you can see, audience, the world of biologics is just fascinating for me, and it's indeed very, very complex. So let's take a moment now and learn how someone can get access to a biologic if it is needed. So the road to getting a biologic can sometimes be overwhelming. Who do I see? How do I get it? Where do I go? And it can often be different for everyone. It may involve different steps depending on your specific situation and needs. And let's look here at an example of a road to a biologic treatment. So I really love this little illustration. It gives me from point A to point B where to go and what to do. And if you're a patient who is trying on your biologic journey, your first step might have been your healthcare provider. And if you have a diagnosis already, they may see you in clinic to assess your symptoms. Meaning, if you are experiencing asthma symptoms or have had an allergic reaction to something, or if you're currently having an eczema flare, you might be seeing your healthcare provider right now. And you may also see them at your annual checkup. You may see a healthcare provider if you have a new symptom, like if you have trouble swallowing, or if you're coughing more than usual, or if you're having difficulty breathing. Your healthcare provider may be a primary care doctor. They may be a PA, such as a physician's assistant, or they may be a nurse practitioner. Your healthcare provider will evaluate you, give you a diagnosis, and or give you a referral to a specialist for more personalized care for a different condition outside of their practice area. Now, if you are referred to a specialist, your specialist will take your complete history. They will take your family history, they will take your history, and they may administer a test or want to observe your symptoms to help them decide if a biologic would be a good fit for you in your healthcare journey. They will take into account the type of medicine you are currently taking, and they will also examine some blood test results maybe in the past, or ask you to do a few more so that they can have a thorough understanding. You and your specialist will discuss this information together and decide on a treatment plan together. If it involves a biologic, your healthcare provider will write a prescription and they will send it into a specialty pharmacy. From there, the medication request is received, your insurance is reviewed, and a contact person from the specialty pharmacy will reach out to you to speak more about the medicine prescribed. They may offer you education, offer you resources such as payment plans, resources, and much, much more. You may get your first biologic treatments in the clinic or your healthcare provider's office first. For example, for some biologics that are out there, you have to do the first 3 treatments in clinic and then you switch to doing them at home. But every single time you should receive training from a doctor, a pharmacist, or a nurse to teach you how to self-inject at home before your at-home doses start. So please be sure to get that information and check with your provider before you start your at-home doses. Communication with your healthcare team is so important, and a lot of places often have online portals or e-charts that can help you along your journey, and you can send in an email or a message to your healthcare provider. Some providers and clinics even allow texting or telehealth appointments. Just remember, keep in contact with your team. If you have any side effects, questions, or challenges accessing the medicine, someone will be able to assist you at every point. And we're going to talk a little bit more about these practical tips later on in our program. And I want to talk to you a little bit about the role of the pharmacy here with biologics. So just like your doctor, your pharmacist plays a very important role in your healthcare team, especially for specialty pharmacies and specialty medicines. Your pharmacist is there to answer any questions you may have about your medicine, to communicate with your provider's office, and even communicate with your insurance. They're also there to ensure that there are no contraindications with medications that you're already taking. So you can find many traditional pharmacists at retail pharmacies like CVS or Walgreens, Target, or your neighborhood pharmacy. But there are also some pharmacists with specialties. just like there are providers with specialized training. And many pharmacists at these specialty clinics are trained in biologics, what to look for, follow-up care, how to store, how to handle, and especially how to educate as well. A specialty pharmacy is a pharmacy that offers medicines that treat conditions that may be rare or complex, or they may stock drugs that are not usually found in retail pharmacies. So these pharmacies take care of medicines that need special handling, storage, or administration, and they monitor these medications for safety and efficacy as well. And some also may offer 24/7 assistance with your medicine. So, because biologics are considered a specialty medicine and they're only available at specialty pharmacies, you may have the option to have your medicines delivered to your doorstep, or you can also pick them up if that is an option as well. Some specialty pharmacies may only work in the delivery of medicines, and they can sometimes come also from another state or even another country. So, with that role of the pharmacy, Dr. Peck, would you mind sharing a little bit with us about specialty pharmacies and exactly what they do?
I'd love to, Stacy, and I appreciate this tag teaming that we're having because the how is just important as the why. We may need to see why a biologic might be a good fit, but how do you get it? What do you do? What now? Because you may think, okay, I've seen my healthcare provider. Now what? Because there are some intricacies left there. How am I going to receive my medicine? Who will contact me? Well, enter the specialty pharmacy, as you started talking about, Stacy. So specialty pharmacies, they provide comprehensive services to people who have complex medical conditions. These are things like autoimmune disorders, inflammatory conditions, sometimes asthma and allergies. And these pharmacies are specially equipped and trained to follow that patient from when you get your diagnosis at that moment with your healthcare provider, and they prescribe a biologic, and it continues long after the biologic leaves the pharmacy and arrives at your home. You can do it at home. They often handle billing, they talk with your insurance company, and they make sure that you're on track with all your medicines. And specialty pharmacies, you shouldn't be intimidated by them because they are designed to work with people who have complex conditions. And many of the medicines they handle require special handling and storage. So they have special equipment for that. They have the capacity, the infrastructure to store biologics, to educate the people who are getting them. Make sure that you don't have any questions, that you haven't thought about anything else after you've left your healthcare provider's office and that time in between, or to help you handle your billing or the scheduling of those. Now, the person or patient receiving the medicine or the biologic, there again, like Stacy said, like I have said, you need training before you can safely use the medicine. So a lot of specialty pharmacies, they have a nurse educator right there on staff, or they can coordinate with one to help you and how to use and deliver the medicine. For me as a nurse, this is something we do every single day. We love patient teaching. We love equipping and empowering patients. So that's a great resource for you that may be connected through the pharmacy. These complex medicines are expensive. So that is true, and they often work with insurance companies, patient assistant plans, and more help and resources to cover the cost for the person who needs that. So those are just a few of the ways, Stacy, that a specialty pharmacy is equipped to assist on a biologic journey. And just like the specialty pharmacy handles complex things, we all know today that healthcare systems are very complex. And thankfully, there are professionals whose job it is to help you navigate the system, coordinate those services, offer education and follow up. All those professionals have specialized training in this field, and they're called patient advocates, patient navigators. Some are called community health worker. You may even see CHW as an abbreviation. Patient advocates can help you with the resources, answer the questions that you have, help with your insurance questions. They are there from the moment of diagnosis to securing your treatment to follow up. Now, most specialty pharmacies are going to have a patient advocate on staff you can speak with if you have questions on taking your medication or if you experience any side effects. And your healthcare team may also have a patient advocate or navigator on the staff. And so may the company where your medicine comes from even. Use all of these resources when and if you need them. Don't hesitate to reach out. They're here to provide you wraparound care and services. And Stacey, I think there's some more information on the next slide there, because in addition to navigators and advocates right there, some companies and clinics may have in-house nurse educators. Now, nurse educators are certified, they're specialized to work with patients who have complex conditions like diabetes, asthma, and a host of others. Nurse educators are highly educated. They've gone through many hours of clinical training and care. And so if you are given a biologic, they can help teach you what it's for and how to deliver the medication. And it's just such great news to know that, hey, you're not alone in this journey. There are a lot of options for wraparound support. Some clinics even have biologics coordinators. So especially a specialty clinic that they deal with these all the time, these professionals serve as a single point of contact. Everything's in-house to help navigate the process of getting a biologic. They are experts on insurance questions, logistics, training, just connecting you to all of the resources that you need. Now, many insurance companies will pay for part of a biologic treatment, and you're responsible, of course, for paying whatever amount that they don't cover. That is the same with any medical treatment. But since a biologic is a specialty medicine, it can be more expensive than other medicines. So your insurance company is going to have more information on how much it costs, the purchase price, and if it's covered, which asthma medicines are covered by your plan. And that cost is a big consideration. The overall cost is going to depend on if you have insurance, what kind of insurance cover you have, the criteria that you need to have to get that insurance approval, and that is all evolving in real time. So check with your insurance company to find out the process for specialty medicines. Some of these other resources we've mentioned could help. Ask that prescribing provider if they have a patient advocate, a coordinator, a nurse educator, a biologics coordinator, someone who can help you with the process. Now, some of you may have had experience with or heard of something called a prior authorization. It is a necessity, but probably not the most fun experience you'll ever have. But a prior authorization is an approval of coverage for medicine from your insurance company. It's something that basically helps insurance companies decide whether or not they are going to pay for certain medicines. Sometimes biologics or drugs that are not usually covered by insurance, but they would be covered if they were noted as medically necessary by your prescribing healthcare provider, whoever's managing that, your doctor, your nurse practitioner, your physician assistant or associate. It's only required on prescriptions when they are billed through the insurance. So they will submit a request and say, we would like to prescribe this, and then the insurance company will respond to that request. But if you're uninsured or if you're paying in cash, then you don't do a pre-authorization approval. If your prescription needs a prior authorization, your pharmacy is going to tell the healthcare provider. They'll give all the information the insurance company is looking for, and then the insurance company decides, yes, we'll cover it, or no, we won't. And then you decide with your prescriber what to do after that. So some of you may have had this with a brand name drug or a prescription drug, and sometimes the insurance company says, okay, we'll consider that, but you have to try this one first. This is our preferred preference. And the healthcare provider can come in and say, okay, that's reasonable, or no, that's not reasonable because of this, and this one is medically necessary. So they're going to handle all of that, and that's really it. But it's important to know kind of that process and that there is an appeal. If it's denied, you can call your insurance company. You can work with that coordinator, the resources that are available to you to say, how do we appeal it? And so sometimes you may need to provide some other information. Now, here is a really important thing to know. Even though there are resources to help you, you are your best advocate for sure. So call, make sure you're proactive in calling your healthcare provider, call your coordinator, call your pharmacy, make sure everything is getting set up. Double check your insurance, make sure they're processing it and that you know what bill is coming to you. Double check the pharmacy, setting up your treatment, schedule your infusion appointments and your follow-up appointments. So again, those are some of the things that are really important. And those are more of the how, Stacy. And I'll let you talk a little bit more about the expense of this, which I know is a concern for a lot of people.
Absolutely. Well, I'm so glad you talked a little bit about patient advocates and how to navigate because you're right. It can be a really complex system, but with the help of others and the help of our team, we can get the job done. And one of the most common questions we hear is, why are biologics so expensive? How can I get help covering the cost? And the truth is, these medicines are really, really complex to make, which contributes to the overall cost of the medication. They often must meet rigorous safety standards of efficacy and standards and go through a much longer FDA safety and approval process as well. And also, these medicines require specific handling and storage standards, which may also contribute to the cost. So if you find yourself in need of assistance in paying for a biologic, there are many places that may offer financial assistance or patient access programs to enroll in. And there are also drug companies that make the biologics may have patient programs, assistant programs available for people without insurance and people whose insurance does not cover biologics. So use the tools in our toolbox, those patient navigators, patient advocates, your community health workers. Go to the drug manufacturer site of the drug that you are taking and look for those patient assistance programs, and they can really help offer you and direct you in the way that you need for that financial assistance. So, Dr. Peck, now that we've gotten on a biologic, what should we do?
Well, you are first going to set up your calendar to track all of your doses because we all know time can pass quickly and we think, has it already been 6 weeks? But 1 week before your dose is due, set yourself a reminder to make sure delivery is on its way. If you haven't heard from the pharmacy or you haven't gotten shipment notification or information from where you're going to get it, you should call and make sure so you're not panicking the day of. An hour before the dose, you're usually going to remove the medicine from the fridge. And after the dose, make sure you've got that calendar set up again so that it reminds you at a consistent interval. And before you start with injections at home, you want to make sure that you're trained on using that device. You may have used other devices in the past, but it's important to know. I have shared before when my son was small, he was using some epinephrine for injection when that was first becoming available. And I may or may not have injected myself in the thumb because I thought as a nurse I knew how to use those devices. But it's important that we know and we treat everyone as a new learning experience, make sure we're adequately trained. So that appointment can be with your clinic's nurse, with a pharmacist from your clinic or your specialty pharmacy. There are videos that you may watch online that your healthcare provider might recommend. And again, all devices are different. So even if you've given yourself shots before, make sure you review the instructions, you ask questions, they may have a trainer you can practice on. Just make sure you absolutely feel confident in what you're doing. And you may need a sharps container, and that can be sent to you from the specialty pharmacy or wherever you're getting your dose from. So when you're giving yourself a shot, set up everything you need. Start paying attention when you go somewhere else and a healthcare professional is doing that. Have the alcohol wipes, the sharps. There may be an ice pack to help or a Band-Aid if needed. You're going to rotate that injection site like I talked about before to help reduce injection site side effects or have one site get tired. And on that calendar that we talked about earlier, write down where you injected because you think you'll remember, and a lot of times we just don't. So you might have the same rotation like thigh, abdomen, arm, or whatever that is that your healthcare provider recommends. So that is important. And Unlike epinephrine auto-injectors, you have to inject these right into the skin. They can't go through clothing. So you want to make sure everything is nice and clean and your technique is good. Now, storing biologics can be hard but it's important because it makes sure that they work well and that they're safe to use. So sometimes it's refrigeration, but you need to think about where in the refrigerator you're putting it. So putting them away from the cooling elements, right in the middle, can help maintain a more stable temperature. Sometimes when you put stuff way in the back, it gets frozen, and you may want to have a thermometer. There's refrigerator thermometers that are relatively inexpensive to monitor the temperature of your refrigerator. Most medications are going to be stored between 35 and 46 degrees Fahrenheit. That's 2 to 8 degrees Celsius. So don't put them in the door because that temperature fluctuates a lot. You know, when you're going to look for your snack and you're standing there at the refrigerator with the door open, that can make deciding what you want, that can make the temperature fluctuate. Don't put it at the back of the fridge. Keep it in its original packaging. That helps protect it from light or moisture. Don't freeze them unless you're specifically told to. Regularly check that temperature of the refrigerator. You can even keep a log. Keep it away from food items to prevent contamination. And ask, always ask. If in doubt, call it in. Ask about any questions you have about storage. That is really important. And most recommendations are going to be to let that injection warm up a little bit before, usually that's about 45 minutes before you give it. Now, of course, you can still travel when you're using a biologic, but there's some things that need to be kept in mind. It goes for long trips, short trips, summer camp, overnight, after school practice, visiting the family for the holidays. Most biologics are temperature controlled and they are sensitive. So once they leave that ideal temperature, they usually will expire in about 2 weeks. But if you have careful planning and scheduling and you have a plan, it's completely doable. Depending on the type that you get, you might even get a travel kit from the company. The travel kit might have a case and your accessories that you need, like ice packs or prescriptions or a sharp container or a training kit. So first you have to know, what is your biologics target temperature? Keep it there. Constant refrigeration, maintaining their integrity, their potency. So even storing the medicine at room temperature, it may cause the medicine to break down or just not work anymore, lose its strength. So once you reach your destination, know, how are you going to store it? Is there a way to keep it refrigerated? How long will your insulated kit or gel pack last and keep it cold? You might want to check if it's light sensitive and what you'll do. So that's where talking with your patient advocate or specialty pharmacy can really be helpful. And they may have somebody who can answer those questions for you. So again, this comes down to planning, having your calendar. When is the next dose? Will we be gone? Will we be able to get it before we leave? How will we keep it with us until it's time? And talking about with your provider about traveling is really helpful. They can give you a prescription, a note that might help you go through security, all of those things, and answer all those questions. Like, what if we lose this? What if it's damaged? Where can I get another one? Should I skip it? Is there an alternative pharmacy? All of those questions about the specifics of what to do. There's so many variables, whether you check it in your luggage or carry it on, and all of those kinds of things. TSA, x-ray machines. Think through all of those things and work through them with your healthcare provider. That's really important. So communication with your care team, so important. If in doubt, call it in. If you forget, if you miss a dose, if something happens, if the medication doesn't fully inject, if you're not sure about the temperature it's been at, call. Call your care team if you have side effects that don't go away. And of course, seek emergency care if you have any severe reaction. So as I told you, I've experienced this myself, and I think that the takeaway here is that when you are living with a chronic illness, there are certain aspects of your life that are inconvenient. There are certain aspects of your life that are really uncomfortable and that are difficult. But in this, you're just choosing. Biologics gives you an option that you may be able to choose what's difficult. Maybe traveling is difficult, but the trade-off is you have significant relief in symptoms so that you're not wheezing, you're not having a eczema flare up, and that trade-off might be appropriate. And so it's always about managing what's right for you, what's right for your family, and talking with your healthcare provider about that. Again, it's so important to keep in communication with your healthcare team when you are using a biologic. So keep a medication diary, make a note if you want to, if you have questions that pop into your head in between visits, keep a place where you can keep those handy. Don't forget to make follow-up appointments and to go and see them. Sometimes you may get on a biologic and things are going great and you kind of forget about going, but if things are going great, we want to keep that going. Make sure you've got everything down with the pharmacy and the insurance and all of those kinds of things. But again, it's just great to have more options that are coming available as technology evolves, as science, as we learn more. We have more options that are available for our patients. And Stacy, thank you so much for the chance to be able to talk with so many lovely listeners who are interested in considering biologics.
Absolutely, Dr. Peck. Thank you so much for being here. And thank you for offering your own personal perspective as in addition to your clinical experience and expertise to this as well. I think it resonates with so many families out there and so many people in our audience as well. So I just think this was a really great program. And audience, thank you for sending in your questions. Right now, I want to do a little knowledge check to see what have we learned today. So this is our poll, and if you feel comfortable answering after participating in this webinar, do you feel confident in speaking to your healthcare provider about a biologic? You know how to navigate biologics with your healthcare team now. Do you feel confident in using a biologic or caring for someone who uses a biologic? And in what to do after you've been prescribed a biologic? Or maybe it's all of the above. So let us know a little bit about what you think and how you feel. And I'm going to ask for those polls to be closed in just 5 seconds. Wonderful. So thank you everyone so much. And it looks like it was all of the above at 82%. So thank you so much, audience. We are truly appreciative of you and having you here today. And if you have your phones with you, which we usually always have them with us, take them out, turn it to your camera, and snapshot a little picture of this resource screen. We have 2 slides right here. One's biologic resources, and these are tips for giving yourself shots and financial resources as well. So definitely take a picture of that. This is on AAFA's YouTube channel at AAFA National, and you can find those videos with additional tips to help you with self-injections and learn more about biologics. And if you need assistance in paying for some of the biologics that are prescribed, we invite you to visit our webpage at aafa.org/drug assistance, where you can find information on programs and discounts. You can also visit the website of the biologic or drug company you receive your medicine from. Drug companies often offer patient assistant programs and resources to help you along in your biologic journey. And there are also, as Dr. Peck describes, lots of patient coordinators or advocates and navigators at their site that can educate anyone on biologics and other prescriptions and offer prescription savings. So if you are unable to access this treatment because of your insurance plan, because they deny it, or because it requires strict criteria, we want you to contact AAFA and let us know. We are gathering patient stories and monitoring it for coverage issues. And we use these stories from our community when we advocate for policy changes to help patients who have access to treatments that may improve or save their lives. You can reach us at any time by going to aafa.org/contact or by calling 1-800-7-ASTHMA. That's 1-800-727-8462. So again, thank you audience for participating. Thank you to Dr. Peck for leading us through this wonderful program on biologics and the patient navigation story of it all. Indeed, it is fascinating and it is complex. So we are so appreciative of that. And again, we have so many great resources to share. Take out your phones again, snap a pic of the slide, and just know you will also be getting a copy of this program in a follow-up email. But we just want to be sure you're connected and have a chance to research on your own as well. So check those resources out. And with that, thank you to everyone. Thank you for the informative discussion. I'd like to thank AstraZeneca, Regeneron, and Sanofi for the support of this educational programming. All content was developed independently by AAFA. And please complete the survey at the end of this program so that we can learn more about your experience, which will help us inform future programming. This program will also be available on our YouTube channel and will be emailed out to anyone who registered for the program. My name is Stacy Denham. Thank you so much for joining us.